Hi, I'm Madhubala Radhakrishnan, founder and president of mCURA. We are based out of Gurgaon. I wouldn't, it is not up to the level expected. Yes, there is an adoption. I'm not saying no to it, but is that the level? No, they can actually maximize the IT adoption. Why it is not adopted is the question. How we are going to address that why is what is the challenge today. Because IT adoption is not by having a billing system in your computer or creating an inventory system in your ERP, that's not an IT. The IT should impact the patient and the doctor. That's when the IT is going to win in healthcare. If you compare any other industry to healthcare industry, IT penetration is much less in healthcare when compared to travel or any e-commerce, anything. Why it is? Because the stakeholders are not included in IT adoption today. That's the major problem. The challenges is doctors using computers at point of care is a big challenge because doctors patient doctor ratio is very less. Because of that, doctor need to see the patient in 3 minutes or 5 minutes. In that 3 minutes to 5 minutes, patient expects doctor attention to be always with him. He cannot use computer or type something, unlike in US or UK where they take 20-25 minutes to meet the patient, take the history, record everything, then come up with the diagnosis. It's not like in India, it's not like that. 3 to 5 minutes. So in that case, how can we expect the doctor to use computers at point of care? And because of this reason, IT adoption or the EMR is not flowing into the industry at all. That's the hard truth. Hospitals can provide technology in terms of, first of all, where hospital need to introduce technology is very important. As a patient, if I get into the hospital, if I need to meet a doctor for 10 minutes, I'm visiting 2 hours inside the hospital. Where and all, I'm visiting multiple counters, I'm visiting multiple billing counters, the waiting time is too much. All these things, can I get those information, basic information in my handphone where I know this doctor will be available at this time? After entering into the hospital or before entering into the hospital, I need to know. Appointment fixing is something, is a very easy concept. Anybody can fix an appointment, but after appointment, what happens is, what is technology can play a major role, which is not happening currently. Doctor has arrived or not? Is he in emergency? Will he arrive after 3 hours? So should I have to go and wait, though my appointment is at 10 o'clock? If doctor is going to come at 1 o'clock, what's the point in me getting an appointment and fixing it? I should know the real time what's happening in the hospital. That technology need to help. That's number one. Number two, for me, if a doctor prescribes X-ray and MRI and pharmacy medicines, I personally or my attender need to go to these counters to see when is the X-ray turn, how long is the waiting time, MRI what is the turn, and everything. This is becoming a major problem for inside the hospital. So my concern is, can technology play a major role inside for that hospital? Okay, MRI waiting time is this much, your X-ray waiting time is this much, and your pharmacy medicines will take this many minutes to get it delivered. If this kind of information patient can get, that will help patient a lot in terms of patient centric. In terms of doctor centric, 50 patients booked appointment, only 30 turned up, 20 patients the time he's going to spend, what next? So he should be informed if patients are not turning up on time, what is that? He can spend that time doing any research or anything related to his medical papers rather than waiting for the patient. That is waste of time for the doctor. So that's how technology need to play a major role. So as I told, mCURA is particular about workflow enhancement and EMR adoption. These are all the two major challenges that we are addressing, which is a big issue in industry today. One is the workflow enhancement in terms of patient getting the right information at right time inside the hospital, and that reduces the waiting time is what is important. And number two, EMR adoption. Since I told you that doctors' time with the patient is very limited and he cannot use 10 gadgets at that time to create an EMR. So we are providing a clinical IT secretary, informatics secretary. She types in everything in the iPad and she gives the e-visit summary to the patient, and doctor signs on it. So it becomes win-win for everyone. Records created, orders processed. From there the workflow becomes very easy for the patient and doctor and for the management to see how many patients have been prescribed, how many patients has been, what is the turnaround time, everything they'll be able to track. For doctors, end of the day, they carry their patient records anywhere that they want. That's very important. As I told you, that waiting time for the patient is reduced, and the payment mode. Currently, what's happening in the hospital is I have to stand in 3 different billing payment counters. We have introduced a tap and pay cash card method, where hospitals can introduce that as a registration card. Patient can put in money. They have to just tap it on the tablet to pay the money. They don't have to go from pharmacy to lab to MRI. They can everything they can pay from their mobile phone, or they can tap the card and pay that amount. So it becomes easy, and for hospital it is a centralized collection system, so they know everything is electronic payments. It is easy for the hospital to maintain and manage the collection. mCURA is not into lead generation or not into aggregator business. We are especially concentrating only on workflow enhancement and EMR adoption. So that way we are very different, and we take the responsibility of running this technology inside the hospital by not just providing the technology. We also provide infrastructure necessary for it, manpower, and then technology. Put together, it becomes an end-to-end service for the hospital. So that way it is easy for the hospital to just adopt the technology by not adding any additional work to their existing resource. The particular USBs, there are 2 USBs that we working on. I mean, currently it's implemented. One is the tap and pay card method inside the hospital, where even uneducated patient can use this card system, not specifically smartphone users. And number 2 is the shortest service path inside the hospital, which is reducing the waiting time at different counters and multiple counter visits. This is the 2 USB, and the way we have taken the responsibility to run this entire smart OPD is very different from what others are doing. 5 years from now, we expect the transformation is going to be huge in next 5 years in healthcare. It's not only about technology. The way patient treated will be different. It is slightly moving, currently started to moving from doctor centric to patient centric delivery, and predictive analysis may come in picture. AI and ML is going to play a major role in technology, but for AI and ML to play a major role, we need to have the data, which is currently in paper format. That's where we all need to work together to create a digital platform, and interoperability is very important. Once the data created, then it helps for predictive analysis and patient-centric delivery. If I know I'm diabetic for 20 years, I know what are all the medicines taken. In my 60 years, I'll know what are all the side effects I'm going to have. My history is going to help me that way to treat the doctor well. The precise clinical decision can happen only with data, and that data is not available today. That's what we all need to work for.